Hello, this is Andre with Tongue Tales on Mondays, and today's tale is about the tongue of a 30 years old female whose chief complaint is acne. Now, unfortunately, we do not know precisely where her acne is on the face, and that would be a very important clinical assessment. And neither do we know exactly what type of acne does she have. Does it have lots of pus? Does it itch? Does it leave scars? Or is it just red bumps? Does it move from place to place on her face? These are all very important clinical clues that would help us to tailor her prescription in a very precise manner. Anyways, she also experiences bloating after meals. She feels fatigued and has brain fog. Additionally, she also sleep talks and has occasional sleep hallucinations. Otherwise, psychologically, there are no any other issues, and her feet and her hands feel cold. Now, let's see what her tongue would tell us. Now, the coating of her tongue at the back is slightly thick, white, and moist, and slightly greasy. So we would suspect phlegm turbidity. The moisture of the tongue is normal, so she produces enough fluids. The shape of the tongue is long. You see, it exceeds her chin. At least in this picture, sometimes it's difficult to judge the true length of the tongue depending on how close the camera is to the face. Usually, I advise my patients to take a picture away from the face, and then it's easier to zoom in and see all the details rather than take the picture very close to the face. Anyways, judging from this picture, this is a long tongue, and it has firm sides. Now, the long body of the tongue with narrow tongue indicates that heat depletes fluids and yin, allowing unchecked yang to thrust the tongue forward. This would explain her sleep disturbance. Heat rises to the chest and disturb her Sheng spirit, which is located in the heart, and the heart is represented by the tip of the tongue. We can also observe the teeth marks on both sides, which is the evidence of dampness accumulation. In conjunction with a thick white coating, we can conclude that pathology involves phlegm turbidity. The color of the tongue is pale, so we would suspect spleen Qi deficiency. A pale tongue with teeth marks indicate a deficiency of spleen Qi. Now, the patient feels mostly cold, at least her hands and feet are cold, and most probably this cold is true cold from spleen Qi deficiency, maybe even with kidney yang deficiency. Now, kidney yang is a warming energy. Kidney is located at the root of the tongue, right? The kidney yang is a warming energy that supports spleen Qi. In its absence, spleen becomes cold and cannot transform and transport fluids, which result in fluid accumulation. This would explain lethargy and the feeling of bloating after meals. This is a classical indication of spleen Qi deficiency. We can also observe red points at the tip of the tongue, and we can see these points spread a bit to the sides of the tongue, here and here. They signify the presence of toxic heat. Patients with an underlying disposition toward retaining and accumulating dampness or phlegm can develop toxic heat quite quickly. So this patient should avoid alcohol and fatty and spicy foods, both of which aggravate pre-existing phlegm or dampness. Finally, we can observe the sublingual veins. As you can see, they are unremarkable, and therefore we can rule out any possibility of serious blood stagnation. Now, let's untangle it. As we already established, acne in this case is primarily due to fire toxins. So we need to choose herbs to clear heat and toxin. And the skin level, we should always focus on at least one herb that opens into the lungs, that has lung energy, because lung manifests on the skin and opens the throat. This is the strategy, this is a classical strategy of herbal medicine. Anytime we deal with a dermatological condition, we want to have an herb that opens into the lung and opens the throat. And in this case, a good candidate would be Huang Qin, Scutellariae. This herb clears fire toxins from the throat, and we could combine it with another herb, Jie Geng, Platycodon, that opens the chest and also transforms phlegm, because there is a phlegm component to this disorder. Another important function of Jie Geng is that it serves as a directional herb that brings the effect of the formula to the upper burner and to the lungs. The location of acne also gives us a clue regarding which herb to select to address fire toxins. For instance, if fire toxin affects the forehead, we know that forehead corresponds with the heart channel. And in that case, the ruling herb would be Zhi Zi, Gardinia. However, if most of the acne manifests on the nose, we know that the spleen and the stomach open into the nose, or rather they manifest on the nose in herbal medicine, because we know that lung opens into the nose, but in terms of dermatology, stomach and spleen manifest on the nose, and they reflect the condition of the digestive system. And therefore the ruling herb would be Huang Lian, Coptidis. It clears fire toxins from the stomach and spleen. However, if this fire toxin manifests mostly on the chin, then the ruling herb would be Huang Bai, Phellodendron, because Phellodendron enters the lower burner, and the chin area represents the kidneys. And this is the sign that the kidneys, the hormonal system, has to be regulated. Now, if this acne manifests on the cheeks, and especially if acne gets worse at times of emotional upset, then we should address the liver channel and the liver organ. And the ruling herb for this presentation would be Zhang, Polygoni, Cuspidati. Now, in addition to clearing heat and fire toxins, we also have to address dampness. And there are two ways we can address it. The most direct and strictly related to dermatological conditions, we want to drain dampness. And for this presentation, I would recommend two herbs. I would recommend Bai Zhi, Angelicae Dahuricae. This herb drains dampness, and it has a very good dermatological effect. And Yi Ren, Semen Coicis. It also strengthens the spleen and dries dampness and has a good effect on acne. However, because this particular patient also has the signs of spleen qi deficiency, simply strengthening the spleen is not enough, and we may want to add herbs that facilitate spleen qi and transform dampness. And this would be, the herb of choice would be Bai Zhu, Atractyloidis. And in case we determine that kidney yang is also insufficient in supplementing spleen qi, we can add Gu Zhi, Psoraleae. This is an excellent herb to tonify kidney yang and spleen yang simultaneously. And this combination of herbs would also nicely balance the cold nature of the herbs that clear phytoxins, and so they would protect the digestive system. Now, in case we have a presence of wind disorder, and how do we know that? We know it if this acne is itchy, if it quickly changes its location or its shape, then we have an element of wind, and therefore we want to add herbs that expel wind. And the good candidate for this formula would be Jing Jie, Schizonepetae. And another important principle to understand in herbal medicine is when we expel wind, we also need to invigorate blood. And so we're going to combine Jing Jie with Chuanxiong, is a blood-moving herb. And although I said earlier that this particular patient does not manifest signs of blood stagnation, because of the treatment strategy, Chuanxiong would be very appropriate in this formula. And finally, a good addition to this formula would be Sheng di Huang, fresh Rehmanniae root, because this herb nourishes yin and calms Sheng, and so it would take care of the Sheng disturbance or the sleep disturbance aspect of this disorder. And so this concludes the presentation on this case. Now, if you have any health issues and would like to know what your tongue tells on you, please send us the image of your tongue and we'll speak about it next. I am Andre with Tongue Tales on Mondays, and I will see you next Monday.